Some medical professionals say they're concerned about who's showing up in their waiting rooms, especially when it comes to comfort and emotional support dogs. And one local doctor says they're seeing a growing number of them. KRIS 6 News reporter Ashley Portillo explains.
One local doctor says at least once a day a patient comes in with a service dog or an emotional support dog. But unlike service dogs, comfort dogs and emotional support dogs require little to no training. Dr. James Mobley, who works at the Medical Arts Clinic in Portland, recalls several times when a patient came in with an aggressive dog.
We've had a couple of instances where dogs have been mildly aggressive, sort of growling or just unhappy with the number of people around.
The dogs Dr. Mobley speaks of are usually comfort or emotional support dogs. Thankfully, no one has been injured, but Dr. Mobley fears the outcome may be different next time.
We don't know the background of the dog or what kind of training it's had or anything.
Allergy testing is also done at the Medical Arts Clinic, and the presence of an animal could stir up someone's allergies. So now it's up to the doctors to come up with a way to make sure everyone is taken care of properly.
We have significant liability here if something happens, and we've done nothing to properly regulate this.
Meanwhile, some patients believe dogs should not be allowed in the waiting room. Others think differently.
I don't necessarily think that comfort dogs are appropriate for a waiting room, but I think the service dogs are working animals, and so they should be allowed.
As of a month ago, the Medical Arts Clinic now requires all patients who bring a pet to sign a form. That form acknowledges that the patient's dog has all proper vaccinations and that dog will not become aggressive in the building. Back to you guys in the studio.